Welcome to your first asthma education lesson. Today we'll be examining how asthma is classified in patients 5 years old and older. While understanding the individual components used to diagnose asthma is vital, being able to determine a patient's level of asthma severity is just as important. It will have a direct impact on what initial pharmacologic interventions are implemented.
By the end of this lesson, learners should be able to define asthma severity, identify components used to classify asthma severity, differentiate asthma severity based on clinical findings, and recognize the role age plays in asthma severity classification. As a reminder, this lesson is not all-encompassing. It is meant to give you the most high-yield information. For further information on asthma severity, visit the Resources tab on our website, where the EPR4 and GINA guidelines have been made available. So, let's start out with a clinical scenario. Pause this video and read the clinical vignette below and think about how you would classify GINA's asthma severity before moving on. We will revisit it later on in this lesson.
Asthma severity can be defined as the intrinsic intensity of the disease process. In other words, asthma severity is how bad a patient's asthma is, which helps us determine how to treat them. Severity is different from asthma control, which will be covered in another lesson. Within the domain of asthma severity, there are 4 categories: intermittent, mild persistent, moderate persistent, and severe persistent. The 2 domains of asthma severity are current impairment and future risk. Current impairment refers to the frequency and intensity of symptoms and the functional limitations the patient is currently or has recently experienced. In the table below, you can see the 6 components of impairment. For the purposes of this lesson, however, we will only focus on the first 4 components: symptoms, nighttime awakenings, interference with normal activity, and short-acting beta agonists, or also referred to as SABA use for symptom control. The second domain of asthma severity is future risk. While some patients may appear to have minimal day-to-day symptoms, they still may be at a significant risk for exacerbations. In this domain, the only component we will focus on are asthma exacerbations requiring oral systemic corticosteroids. Now, let's take a look at each one of these components individually to see how they may influence asthma severity.
As you can see from this table, the NAEPP has asthma classification guidelines for 3 distinct age groups: birth to 4 years old, 5 to 11 years old, and 12 and older. What you may also notice is that while the frequency of each component for ages 5 and older are for the most part uniform, the frequency of components for ages birth to 4 years old do vary at some points. For this reason, asthma severity in ages birth to 4 will be discussed in another lecture, and each component of asthma severity for ages 5 and older will be discussed together.
The first 2 components we are going to talk about are symptom frequency and SABA use. Examples of asthma symptoms are how often the patient is having cough, wheezing, shortness of breath, chest pain, or difficulty keeping up with their friends. The most common SABA rescue inhaler you will see used is albuterol. Now, the first question to ask yourself is the patient having symptoms or needing their SABA more than twice a week? If they aren't, their asthma is considered intermittent. But if they are having symptoms or needing their SABA more than twice a week, their asthma is persistent. If your patient is having symptoms or SABA use more than twice a week, ask yourself, is it daily or is it multiple times a day? If their symptoms or SABA use is daily, their asthma would be classified as moderate persistent. But if it's multiple times a day, their asthma would be classified as severe persistent. So 2 days a week is the threshold for intermittent versus mild persistent asthma. Daily symptoms or SABA use is moderate persistent, and multiple times a day is severe persistent.
The next component we're going to talk about is nighttime awakenings due to symptoms. This component for the most part follows similar rules with regards to intermittent versus mild persistent asthma, but instead of 2 times a week, the threshold is 2 times a month. If a patient is being woken up by symptoms more than twice a month, their asthma can be classified as mild persistent. From there, the classification of moderate persistent and severe persistent is straightforward. If the patient is having weekly nighttime awakenings, their asthma can be classified as moderate persistent, while if they are waking up nightly with symptoms, their asthma would be classified as severe persistent. The next component we are going to discuss is asthma exacerbations requiring oral steroids. Now, regardless of age, this is extremely straightforward. If your patient has needed oral systemic corticosteroids more than once in the past 12 months to treat their asthma symptoms, their asthma can be classified as persistent. Everyone can use oral systemic corticosteroids once a year before their asthma is considered persistent. Now, being able to distinguish mild, moderate, and severe persistent asthma cannot be easily classified with this component. But as a general rule, the more courses of oral systemic corticosteroids for asthma symptoms needed, the more severe the asthma is. The last component we're going to look at is interference with normal daily activities due to asthma symptoms. Like the last component discussed, this will really only give you a sense for whether your patient's asthma is intermittent or persistent. The degree of limitation is extremely subjective, but it's accurate to say that if your patient is having any degree of limitation of normal daily activity due to their asthma symptoms, their asthma is some degree of persistent. Back to our clinical scenario. Gina is having daily daytime symptoms requiring SABA use and weekly nighttime symptoms. She's having some degree of interference with normal activity and has gotten 2 courses of oral systemic steroids for symptoms in the last year. So, based on this, we can classify her asthma severity as moderate persistent asthma.
Trying to determine a patient's asthma severity, it's important to look at the whole patient. Their story may be inconsistent when it comes to one component such as daily symptoms or nighttime awakenings, but if you see they are using their SABA frequently or they have multiple oral systemic steroid courses, that information can help direct your next steps. Lastly, the asthma severity table is full of information and can get confusing. If you can't memorize it all, find a memory hook that works for you. I find the below memory hook about SABA use helpful. This month, this week, this day, all day. If your patient is needing their SABA monthly, their asthma is likely intermittent. If they're needing it weekly, it's likely mild persistent. If they're needing it daily, it's likely moderate persistent. And if they are needing it all day or multiple times throughout the day, it's likely severe persistent. Now, head to the practice section on the asthma curriculum website to continue honing your asthma classification skills.